Welcome to today's COVID-19 update. We're speaking with the Honorable Minister of Health, Dr. Frank Anthony. Minister Anthony, again, thank you so much for joining us.
Well, thank you once again for having me on the program.
I wanted to start with just a quick update on the filaria MDA program.
Well, as you know, we've been rolling out this program now, and we're in Region 5, Region 7, Region 1, um, we're in Region 2, and we are getting really good traction with people coming out and taking their tablets. So far, we've exceeded more than 400,000 people who would have taken their tablets, and that's good. So we are on target, but we still need the collaboration of everyone to ensure that we get beyond the 65% of the population taking these tablets. So I'll urge everyone who probably haven't taken their tablets as yet to make sure that they come out and get their tablets. And when you see the people in the purple t-shirts coming around, to make sure that you ask them for your tablets. That's very important. As you know, with filaria, this is one of the neglected diseases that WHO has identified, and Guyana is one of those countries who have been working actively to eliminate filaria from Guyana. So we have, with this round that we are doing, if we get beyond 65%, we would be assessed by WHO, and they would certify Guyana free of filaria. So this is a very important thing, to be able to eradicate the disease from a country. It's a very important exercise that we engaged in, and we're very confident with the cooperation of the public that we'll be able to do so. So we really want to encourage everyone to take their pills, and let's eradicate filaria from Guyana.
Thank you, sir. As we get into COVID-19, I wanted to ask if the ministry has completed immunization of frontline workers against the disease.
No, because while we have opened for two categories of people, that is healthcare workers and persons who are older than 60 years and older, some healthcare workers have been coming forward and getting their immunization shots, and others haven't come as yet. So we still have a few more healthcare workers to go, but this time period is open, so it's not just healthcare workers and then we go to those who are 60 and above. So we still have an opportunity, if you haven't gotten your shot, to be able to get it. But I'm really optimistic because I've seen the rush, so to speak, to get the vaccine, which is good. I've seen a lot of older persons coming out to get their vaccine, and I think that's quite commendable that they want to get their vaccines. As we know, these vaccines are very protective, and once you get your shot, you come back for your second dose, and you'll be protected so that you wouldn't get the more severe form of the infection, and that's extremely important.
Yes, as you rightly said, we've seen an overwhelming response from the elderly, and our teams have visited a few regions right now. So I wanted to ask you if there have been any testing at senior citizens' homes.
We have yesterday we have done 4 of the homes for the elderly in Georgetown, and those remaining ones we'll be doing over the next couple of days. So, and again, the response was really good. Everyone that we approached to take the vaccines, they did. And so we are very happy with that response.
All right, if you can just briefly assist me, I know you're finalizing the list for Region 4. Could you just briefly tell us some of the vaccine sites that we have up?
Region 4, we currently have a site in the Ministry of Health compound. The entrance is closer to the Square Coffee on that one side. So people can actually come from that area and come right into the compound. We have a huge tent that was set up there. So persons come in. The process is really simple. You come in, you wait, you're documented, and then you go, you get your shot, and then there's another tent where persons who have received their vaccines will observe you for 15 minutes before you leave. And that, again, is out of abundance of precaution to make sure that there's no adverse reaction. So we have that site in the ministry compound. We have a site at Diamond. We have a site at the Georgetown Hospital on Lamaha Street, and by next week, there would continue to be a site at the Georgetown Hospital compound, but they'll change the location of the site within the compound. And of course, we have on the East Coast, we have at the Enmore Polyclinic. So in Region 4, we have one site on the East Coast, which is Enmore, one on the East Bank, which is Diamond, and two in Georgetown.
All right, Minister. My last question for you comes from the Guyana Chronicle, and they're asking a few countries have suspended or delayed the rollout of the Oxford AstraZeneca vaccine over concerns of blood clots, and they're wondering if Ghana is concerned or if you're concerned about this.
We are not concerned because if you go back and look at the incident, there was one case where somebody had some clotting problems, but when it was further investigated, it was totally unrelated to the vaccination. The European Regulatory Authority has put out a statement, and that statement clearly said that there wasn't a link between the vaccine, AstraZeneca vaccine, and this clotting problem that was discovered. So since there's no link, there's no reason to be concerned about it.
All right. If I can just follow up as we end, since the vaccines have been issued, have we had any particular report in that sort of with adverse effects or so?
No, we don't. We have, and as you know, we've been monitoring because we have a pharmacovigilance committee, and we have been monitoring to see whether there will be any adverse events. Globally, with AstraZeneca vaccine and with the Sinopharm vaccines, we don't expect adverse events because not much has been recorded in the global literature, scientific literature. So we don't expect them, but we still monitor for them. And we have set up a national pharmacovigilance committee, and if we do detect any such complications, if you like, then we are also obligated to report it internationally so that others can learn from our experience. But since our immunization program has started for COVID-19 vaccines, we have not had any adverse events because these are extremely rare occurrences. What we do have is what you would say reactogenic side effects, meaning that when you inject someone, some people would have maybe a little bit of pain at the site of the injections. Other would probably have a little bit of fever and so forth. So different people react differently, but within a 24 hours period, all of that would, disappear. So it's nothing really to be worried about. And, that's how people react when they get immunization.
Yes, sir. Minister Anthony, thank you so much for speaking with us.
Well, thank you very much for having me.
Well, that's it for today's COVID-19 update. Of course, we just spoke with the Honorable Minister of Health, Dr. Frank Anthony. Remember, for more information, you can log on to our website, dpi.gov.gy, and the Ministry of Health's website as well, health.gov.gy, and of course, our social media platforms.